Comfort and pain relief measures. In this presentation, we hope to equip you with both the physical and mental tools to cope with labor. You may use comfort measures at home in early labor, at the hospital until you receive pain relief medications if you choose them, or for the entire labor. Labor is a marathon, not a sprint, so pace yourself, rest between contractions, and stay hydrated. Relaxation. A contraction is when the muscles of your uterus tighten up like a fist. Each contraction reaches a peak or strongest point and then subsides. Allow yourself to relax in between each contraction. When in labor, you can get caught up in a pain, tension, fear cycle. Relaxation methods, along with a positive attitude, realistic expectations, and a calm environment, can help prevent or break this cycle. The uterus is a large, hardworking muscle that requires oxygen to work effectively. When we are scared or in pain, it is instinctual to hold our breath and tense our body. We want you to try and learn to override that instinct. Trust your body. We recommend using the 3 R's: rhythm, relaxation, and rituals to allow your body to stay relaxed. Rhythm and relaxation are both accomplished using slow, deep breathing. As a contraction starts, relax your body and take a slow, welcoming breath. Then continue to deep breathe by inhaling to a count of 4 and exhaling to a count of 4 until the contraction subsides. Finish with a cleansing breath. This breathing relaxes your body, calms your mind, and gives you and your baby extra oxygen. You can practice breathing exercises at the website on your screen. Choose a focal point. For each contraction, establish a ritual to keep you focused. Concentrate and begin deep breathing. Stay calm and motivated. If you lose your concentration and focus, you can become overwhelmed. For many women, this breathing pattern will carry you through the labor. For some, toward the end of labor, a faster breathing pattern or pant may be necessary. Support person, remember to encourage, support, and stay calm. Your healthcare provider will guide you when necessary. Comfort measures are used to interrupt or block negative pain signals with positive signals. One of the most important comfort measures is a continuous support person in labor to provide encouragement and suggest different positions. Warm baths and showers can reduce discomfort. It is important not to get too warm in the tub and to stay well hydrated. The birthing ball, essentially the same as an exercise ball, can reduce pain and help you feel more comfortable during labor. Another tool used for positioning is the peanut ball, while side-lying or reclined. Create a calm environment in your room using music and dim lighting. Pool noodles, hard balls, or tennis balls can be used to apply counter pressure for back labor. Cool cloths can be comforting to patients in labor as they are working hard. Women in labor are encouraged to change positions frequently, walking, standing, squatting with support, using a birthing or peanut ball, and being on hands and knees. Try adding a rhythmic or rocking movement during contractions. Listen to your body. If you are experiencing back pain, try forward-leaning positions to ease the pressure and encourage baby to settle into a different position. Standing and walking in labor work with gravity, make contractions seem less painful, lessen backache, may speed up labor, and help align the baby in the pelvis. Being active and upright can help your labor progress while keeping you more comfortable. Sitting also works with gravity and allows you to rest between contractions. It allows patients to sit upright, which can help baby to get into a good position for birth. Some women also sit on a ball and lean forward on a table or bed so their support person can massage their neck and back. Instead of being round, a peanut ball is elongated like a peanut. This can be used while resting or sleeping, as it is easier to lift your legs over and around. Sometimes in labor, the baby's head is down, but their face is positioned toward your stomach instead of your back. This can cause what is called back labor. Hands and knees position lessens the force of gravity and gives the baby room to move into a better position for birth. It can reduce the intensity of the contractions and improve backache. Another comfort measure for back labor is counter pressure, which consists of steady, strong force applied to one spot on the lower back during contractions, using the heel of the hand, or pressure on the side of each hip, using both hands. It's a good idea for you and your support person to practice these techniques. Squatting tilts the uterus and pelvis forward, helping to place the baby in proper alignment for birth. This position tends to intensify contractions and relieve back pressure. Massage techniques by your support person can be used on the back, neck, and shoulders in this position. A squatting bar can be set up on the end of the birthing bed, which can be helpful to support you in this position. While mom maintains a positive attitude, uses breathing, relaxation, and position changes, her labor support person can encourage and reassure her, assist with relaxation, time contractions, and help change positions. Providing ice chips, popsicles, cool cloths, and massage are other support measures. Remember to stay calm and positive. The pain experienced in childbirth is very different for every mother and each labor. The length of each labor will differ as well. Sometimes comfort measures for dealing with labor will not be enough, and therefore it is important to keep an open mind. You may change your plan once you see how you cope with the contractions of labor. The choices for pain medication will depend on your stage of labor. Narcotic analgesics are given by injecting them into a muscle or into a vein. The way the medication is given depends on your stage of labor. Typically, narcotics are given into a muscle for early labor, which will last 3 to 4 hours, or into a vein during more active labor, which works very quickly and can be repeated as needed. Narcotics will not take the pain away completely, but will help dull the discomfort. These medications cross the placenta and may make the baby sleepy. They may make you drowsy, dizzy, itchy, or nauseated. There are medications to counteract these side effects. IV medication, usually fentanyl, for active labor, gives good relief with fewer side effects. Patients can still have an epidural in labor after having had these narcotic medications. Nitrous oxide may be available depending on the facility in which you have your baby. It is an analgesic gas inhaled during the contractions by means of a face mask. It is more commonly known as laughing gas, which is a combination of oxygen and nitrous oxide. It works quickly and wears off quickly when discontinued. Short-term effects include relaxation, reduced anxiety, numbness and tingling in the face or hands. It will dull the discomfort, but will not take the pain away. Epidural availability is dependent upon the facility in which you are delivering. Epidurals can provide effective pain relief during labor and birth. Occasionally, pain relief may not be complete. The procedure will be explained by the anesthesiologist and questions answered. There will be an information sheet to read and understand and a consent form to sign. You will require an intravenous. Sitting in the correct position as demonstrated in the picture, local freezing will be injected in your lower back. A fine plastic catheter will then be inserted to allow the administration of medication. This will help decrease your labor pain. The catheter is taped securely and remains in place until after the delivery of the placenta. You will remain in bed after receiving your epidural, but position changes in bed are encouraged. Your bladder will be drained periodically by your nurse using a catheter. Risks can include lower back pain, low blood pressure, prolonged labor, headache, and fever. When making decisions regarding pain medication, think of the acronym BRAIN. What are the benefits? What are the risks? What are my alternatives? What do my instincts or intuition tell me? Finally, what if I say no or not now? How does this affect my choices later on? Your healthcare provider can answer any questions you may have. Thank you for watching Horizon Health Network's video on comfort measures and pain relief in labor. We encourage you to view the next video, Delivery.